At 32, Daniel Matthews was just a single father working double shifts at Boston General Hospital, his medical career rebuilt from ashes after tragedy took his wife. No one noticed him anymore, not the board of directors who passed him over for chief resident, not the colleagues who once lauded his surgical brilliance. But on that rainy Tuesday evening in the hospital parking garage, when he saw the struggling teenage girl being forced into a black SUV, something dormant awakened within him. The girl's desperate eyes locked with his for just 1 second, and in that moment, Daniel recognized what no one else could see. It wasn't just another troubled teen acting out. It was something far more sinister that would force him to confront the past he'd buried alongside his wife's memory. Dr. Daniel Matthews moved through the bustling corridors of Boston General Hospital like a ghost, efficient, reliable, but ultimately invisible. His short blonde hair was always neatly combed, his scrubs always pristine, his manner unfailingly polite. Fellow doctors and nurses greeted him with the perfunctory respect reserved for competent colleagues, but few bothered to look beyond his quiet demeanor. At 32, he was neither young enough to be remarkable nor established enough to command attention. The small apartment he shared with his 8-year-old daughter Sophie in Cambridge was similarly unremarkable, clean, functional, with framed medical illustrations, the only hint of passion in an otherwise practical space. But in his bedroom drawer lay the single object that betrayed a different past. A tarnished silver medal of excellence from Johns Hopkins Medical School, engraved with words that had once defined him. Daniel Matthews, surgical prodigy, class of 2015. He hadn't touched it in 3 years, not since the night Rebecca died and he'd traded surgical brilliance for predictable safety. His colleagues now knew him only as the reliable ER doctor who never complained about taking extra shifts, who always covered the holidays, who never made waves. What they didn't see were his hands, still surgeon's hands, with long, dexterous fingers that sometimes trembled when he thought no one was looking, haunted by muscle memory of more precise, more critical work than stitching up weekend warriors and prescribing antibiotics. Only his daughter Sophie saw glimpses of the man he used to be, in the way he still performed surgery on her stuffed animals with meticulous care, his face transformed by focus and purpose that vanished the moment the playful operation was complete. Sometimes, late at night, after Sophie had gone to bed, Daniel would unconsciously trace the scar on his right wrist, a faint silvery line marking where surgeons had attempted to repair the nerve damage that had ended his career. It was barely visible to others, but to Daniel, it might as well have been painted in neon, a permanent reminder of everything he'd lost. The few personal photos in their apartment showed a different Daniel, standing proudly in surgical scrubs beside Rebecca, both of them beaming with the confidence of people who knew exactly who they were and where they were going. Now those photos were tucked away in albums, too painful to display but too precious to discard. Sophie had her mother's eyes, bright, intelligent, missing nothing. "Daddy, why don't you do the special surgeries anymore?" she'd asked once, innocent curiosity cutting straight to the heart of what he avoided discussing. He'd managed a smile and a deflection. "Because the emergency room needs me more, sweetie." The truth, that he no longer trusted himself with a scalpel when it mattered most, remained unspoken. His supervisor, Dr. Harrison, had once been a mentor and friend. Now their interactions were limited to scheduling and perfunctory performance reviews. "You're wasted in the ER, Matthews," Harrison had remarked during their last meeting, not unkindly. "Have you considered trying again? The hand looks steady enough." Daniel had smiled politely and changed the subject. What Harrison didn't understand was that the physical tremor was the least of it. The real damage was invisible, a fracture in his confidence that no surgery could repair. 3 years earlier, Daniel had been the rising star of neurosurgery at Massachusetts General, the youngest attending neurosurgeon in the hospital's history at just 29. Medical journals had published his groundbreaking techniques for pediatric brain surgery. Department heads from around the country consulted him on their most challenging cases. His wife Rebecca, a brilliant neurologist herself, had been his perfect counterpart. They were Boston's medical power couple, destined for joint research chairs and medical textbook immortality. The night everything changed started with a celebration. Daniel had just completed a 14-hour surgery, removing a tumor others had declared inoperable from a 6-year-old girl. "You're going to change medicine, Danny," Rebecca had whispered as they drove home through the rain, her hand warm on his knee. "What you did today, No one else could have done it. He remembered smiling, exhausted but triumphant, taking his eyes off the slick road for just a moment to look at her. The oncoming driver who crossed the center line was later found to have been texting. Rebecca died instantly. Daniel escaped with a severed nerve in his right hand. A minor injury for most, but catastrophic for a neurosurgeon who operated on millimeter margins. The tremor was subtle but undeniable, emerging under stress or fatigue, destroying the superhuman steadiness that had made him exceptional. He underwent 3 surgeries and 18 months of physical therapy, but the damage was permanent. The day his department chief suggested administrative medicine instead of surgery, Daniel resigned his position entirely, retreating to emergency medicine where his broad knowledge was valuable, but the stakes were lower. It wasn't just my hand, he confessed to his therapist, in the sessions he eventually abandoned. I lost my nerve when I lost her. When well-meaning colleagues mentioned his wasted potential, he would smile politely and change the subject. The silver medal remained in his drawer, along with the last paper he'd published. Novel Approaches to Pediatric Brain Stem Tumors, its pages now yellow and curling at the edges. His daughter Sophie knew only that Daddy used to fix people's brains, a past that seemed as distant and fantastic to her as fairy tales. The night of the accident replayed in his dreams with merciless clarity. The screeching tires, the shattering glass, Rebecca's final gasp. He'd been completely sober, only slightly tired, but the split second of distraction had been enough. The rational part of him knew it wasn't truly his fault. The other driver had crossed the center line while texting. But rationality offered little comfort in the darkness before dawn, when guilt pressed down like a physical weight. In the months after the accident, colleagues had rallied around him, offering support, references, connections. But as his self-imposed exile from neurosurgery stretched from months into years, those same colleagues began to look at him differently, with pity, confusion, sometimes barely disguised impatience. The brilliant Dr. Matthews had become a cautionary tale, whispered about in hospital break rooms. So much potential, such a shame. Daniel's carefully constructed routine began to unravel the night he witnessed 16-year-old Mia Reynolds being dragged toward a black SUV in the hospital parking garage. Her desperate eyes had met his across the concrete expanse, her mouth forming one word: help. His instincts as both doctor and father propelled him forward, shouting for security as the man forcing her into the vehicle fled. Mia, disheveled and trembling, clutched her arm where angry red finger marks bloomed. He said he was taking me to a special facility, she whispered, that my parents had authorized it. When hospital security arrived, followed by Mia's parents and Dr. Eleanor Prescott, the hospital's formidable psychiatric director, the situation shifted with disorienting speed. Dr. Matthews, Prescott addressed him with barely concealed annoyance. Mia is my patient. She has severe delusional disorder and was attempting to flee a necessary transfer to our adolescent psychiatric unit after threatening self-harm. Mr. Reynolds, a powerfully built man with cold eyes, added, "We appreciate your concern, doctor, but my daughter is manipulative and dangerous to herself. This is exactly the attention-seeking behavior that's part of her diagnosis." When Daniel mentioned the bruises on Mia's arm, Mrs. Reynolds sighed dramatically. She does that to herself. It's documented in her file. But something about the girl's terrified eyes didn't align with manipulation. It was raw fear Daniel recognized from trauma patients. When he attempted to examine Mia more thoroughly, Dr. Prescott stepped between them. "This isn't your department, Dr. Matthews. Return to your ER duties immediately." The following day, Daniel was summoned to Hospital Administrator Victor Blackwell's office, where he found not only Blackwell but also Dr. Prescott and the Reynolds. "Dr. Matthews," Blackwell began gravely, interfering with psychiatric protocols and suggesting impropriety by the family of a minor patient are serious matters. The Reynolds had filed a formal complaint, claiming Daniel had traumatized their already fragile daughter. "She had to be sedated after your intervention," Mrs. Reynolds accused, tears streaming down her perfectly made-up face. "She's been making up stories about being experimented on for months, and now she claims you're the only one who believes her." Dr. Prescott's assessment was clinical and damning. Dr. Matthews' behavior suggests a problematic emotional transference, possibly related to his own unresolved trauma. His interference has set Mia's treatment back significantly. Daniel attempted to defend himself, describing the bruising pattern inconsistent with self-harm, but Blackwell cut him off. You're an ER doctor, not a psychiatrist or a detective. One more incident like this, and we'll be forced to reconsider your position here. The humiliation might have ended there, had Daniel not searched Mia's name in the hospital system, discovering a pattern of admissions under Prescott's care, each with increasing medications but vague symptom documentation. When he discreetly questioned a nurse who had worked on Prescott's unit, word quickly reached administration. The next morning, his shifts were cut by half, budgetary adjustments according to the official email. His colleagues' whispers followed him through hospital corridors. Heard Matthews is having some kind of breakdown. Always the quiet ones who snap, right? First, his surgical career crashes, now this. Even Dr. Jameson, once his friend, pulled him aside with patronizing concern. Everyone knows you've had it rough since Rebecca, but chasing conspiracy theories about psychiatric patients? You're destroying what's left of your reputation. The final blow came when Sophie's teacher called, concerned about a drawing his daughter had made, Daddy fighting bad doctors to save a girl. The school counselor recommended family therapeutic intervention given Daniel's deteriorating mental health status as reported by hospital colleagues. That evening, Daniel received an email from Chief of Staff Dr. Harrison. Administrative leave pending psychological evaluation recommended. Report to HR tomorrow to discuss terms. When he arrived home, his babysitter, Mrs. Finch, greeted him with uncomfortable sympathy. I heard what happened, Dr. Matthews. Just awful how they're treating you. Apparently, someone from the hospital had called her, suggesting Daniel might be unstable and advising her to report any concerning behavior. The realization that they were systematically isolating him from his colleagues, his income, potentially even his daughter, hit him with sickening clarity. That night, after Sophie was asleep, Daniel received a text from an unfamiliar number. This is Nurse Jenkins from Dr. Prescott's unit. I believe you about Mia. You're not the first to notice. Meet me tomorrow, Riverside Cafe, noon. Come alone. Hope flickered briefly, only to be extinguished by suspicion. Was this a genuine ally, or a trap to further discredit him? Either way, with his career and custody potentially at risk, could he afford to pursue this? The walls of his apartment seemed to close in around him, the carefully constructed sanctuary of his post-surgical life suddenly feeling like a prison of his own making. On his kitchen counter, Sophie's homework lay unfinished, a science worksheet about the human brain, with her childish handwriting, "My dad knows all about brains. He's a hero doctor." Daniel sat in his darkened living room long after Sophie had gone to bed, staring at his resignation letter drafted on his laptop. The words blurred before his exhausted eyes. I hereby tender my resignation, effective immediately. One signature would end this nightmare, protect his custody of Sophie, preserve what remained of his professional reputation. He could relocate, find another hospital position somewhere quiet, somewhere no one knew about the surgeon he used to be or the troublemaker he'd become. His phone buzzed with a text from Dr. Harrison. Be reasonable, Daniel. Take the leave. Get the evaluation. Admit you were mistaken about the Reynolds girl. We can make this go away. The sensible path was clear. Walk away. Protect what mattered most. Daniel closed his eyes, his right hand trembling slightly, as it always did under stress. When he opened them again, his gaze fell on Sophie's backpack leaning against the wall, decorated with a hand-drawn picture of her father wearing a superhero cape. Beneath the childish figure, Sophie had written in crooked letters, "My dad fixes people." Something in his chest tightened painfully. He rose slowly and walked to his bedroom, pulling open the drawer where his past lay buried. His fingers found the silver medal, its weight solid and real in his palm. For the first time in 3 years, he allowed himself to remember not just the loss that had defined him, but the oath that had preceded it. First, do no harm. With sudden clarity, Daniel realized that walking away from Mia Reynolds would violate that fundamental promise. He picked up his phone, and instead of responding to Harrison, he typed a new message to an old medical school classmate now working at the State Medical Licensing Board. Karen, I need your help. I think something very wrong is happening at Boston General. The tremor in his hand stilled as purpose replaced uncertainty. Whatever came next, he wouldn't be running away again. That night, Daniel slept without nightmares for the first time in years. When he woke, The first pale light of dawn was filtering through his curtains, and his mind was clear. He would meet Nurse Jenkins. He would find out what was happening to Mia Reynolds and the other teenagers in Prescott's unit, and he would need to prepare for the storm that would follow. The Riverside Cafe was busy with the lunch crowd when Daniel arrived, scanning the tables for a face he knew only from hospital ID badges. In the far corner, a woman in her 50s with short gray hair nodded almost imperceptibly. As he approached, she gestured to the chair across from her, speaking without preamble. "I've worked in psychiatric nursing for 27 years, Dr. Matthews. I've seen troubled teens, psychotic episodes, the full spectrum. What's happening in Prescott's unit isn't treatment, it's experimentation." She slid a flash drive across the table. Medication logs, admission records, research protocols that were never IRB approved. 16 adolescents in 2 years, all following the same pattern, admitted for minor issues, escalating symptoms under Prescott's care, then transferred to a private facility called Northfield Institute where they vanish from the system. Daniel's training kept his expression neutral, but his mind raced. "Why are you showing me this?" She smiled sadly. "Because you're the first doctor who noticed and actually did something. And because Prescott is presenting her breakthrough adolescent compliance therapy at the state medical conference next month. Whatever she's doing to these kids, she's planning to expand it." The medical review board hearing room fell silent as Daniel approached the podium, aware of the hostile stares from hospital administration seated on one side and the impassive faces of the state board members on the other. His evidence had secured this hearing, but the burden of proof remained squarely on his shoulders. "I stand before you not as a disgruntled employee," he began, his voice steadier than it had been in years, but as a physician bound by oath to protect vulnerable patients. Using the projector, Daniel methodically presented his findings. Pharmacy records showing Prescott's patients receiving experimental drug combinations not approved for adolescents. Admission patterns revealing teenagers like Mia entering with minor symptoms but developing severe psychiatric emergencies under Prescott's care. Financial records Karen had helped him obtain showing payments from Northfield Pharmaceuticals to a research foundation controlled by Dr. Prescott and Mr. Reynolds. In the past 2 years, 16 adolescents have been subjected to what I believe is unauthorized clinical research disguised as psychiatric treatment, Daniel continued, displaying brain scan comparisons that drew audible gasps from the medical professionals present. These medications, in these combinations, are producing brain chemistry alterations consistent with Northfield's patent application for a compliance therapy drug cocktail, Dr. Prescott rose to her feet, face contorted with fury. "This is absurd. Dr. Matthews is clearly suffering from psychological issues himself." But when Daniel played the recording Mia Reynolds had secretly made on her phone before it was confiscated, Prescott and Reynolds discussing brain plasticity modifications and behavioral compliance testing, murmurs swept through the Sauce room. The coup de grace came when Daniel revealed his final witness, not Mia, who remained under Prescott's control, but Nurse Sarah Jenkins, who had assisted in the adolescent psychiatric unit for 3 years. "I was told the protocols were approved research studies," she testified, voice shaking. "But when I asked to see the consent forms, I was reassigned. These children were selected because they were vulnerable, from wealthy families with parents too busy to investigate thoroughly, or troubled teens whose complaints would be dismissed as manipulation." As Jenkins described the pattern of escalating medication, false documentation of symptoms, and eventual transfer to Northfield's private facility, Daniel observed the board members' expressions shifting from skepticism to alarm. Dr. Harrison and Administrator Blackwell stared at the floor, pointedly avoiding eye contact with anyone. But Daniel's focus remained on Prescott, whose composure was cracking with each new revelation. When Jenkins finished, the head of the medical board turned to Daniel with new respect. "Dr. Matthews, your thoroughness is commendable. We'll need to interview each affected patient and family." Prescott lunged to her feet again. "This is preposterous, Doctor. Matthews is hardly qualified to evaluate psychiatric protocols. He's just an ER doctor, and one with a documented history of instability following his wife's death." The room fell silent, her desperation hanging in the air. Daniel's response was measured, his surgeon's composure fully returned. "Actually, Dr. Prescott, before I was just an ER doctor, I was the youngest attending neurosurgeon at Mass General, specializing in pediatric neurological disorders. He rolled up his sleeve, revealing the surgical scar on his wrist. I left neurosurgery after an accident damaged nerves in my hand. But my knowledge of brain chemistry and neurological medication protocols remained intact, which is how I recognized that your treatment was actually experimental neurological modification without consent. The silence in the room was absolute. Prescott's face drained of color as she realized her fatal error. She dismissed him as a broken ER doctor, never investigating who he had been before. The board chairwoman's voice cut through the tension. "Dr. Prescott, Mr. Reynolds, please remain for questioning. Hospital administration representatives as well. Dr. Matthews, thank you for your courage in bringing this matter forward. The board will require your ongoing consultation as we investigate further." As Daniel gathered his materials, he caught Dr. Harrison's eye across the room. His former mentor nodded slightly, a gesture of respect that 3 years ago would have meant everything to Daniel. Now, it was merely an acknowledgement of a truth he already knew. He had found his way back to being the doctor he was meant to be, not despite his damaged hand, but because of what the injury had taught him about courage, purpose, and the true meaning of healing. 6 months later, Daniel stood at Boston Children's Hospital's neurosurgery department, not as a surgeon, but as the newly appointed Director of Patient Advocacy and Medical Ethics, a position created specifically for him following the Prescott investigation. The inquiry had revealed the full scope of her research, an attempt to develop pharmaceutical protocols that induced compliance and reduced defiance in adolescents, marketed to parents of difficult teenagers as a miracle treatment. 7 doctors and administrators had lost their licenses. Northfield Pharmaceuticals faced criminal charges and multiple lawsuits, and 16 teenagers, including Mia Reynolds, were receiving proper treatment to reverse the neurological damage. Daniel's office wall now held 2 framed items side by side, his old silver medal from Johns Hopkins and a crayon drawing from Sophie showing her father without a superhero cape, just a stethoscope and a smile, with the words, "My dad helps people tell the truth." He rarely performed surgery now, though occasionally he would consult on complex pediatric neurological cases. His diagnostic skills still razor-sharp, even if his hands would never again hold a scalpel in an operating room. But he had found something he hadn't realized he'd lost along with Rebecca, not just his confidence, but his voice. When a timid first-year resident knocked on his open door, Daniel recognized the uncertainty in the young doctor's eyes. "Dr. Matthews, I have concerns about a patient treatment plan, but the attending says I'm overreacting." Daniel smiled, gesturing to the chair across from his desk. "Tell me everything," he said quietly. "That's why I'm here." Later that evening, as he drove home to Sophie, Daniel's right hand rested on the steering wheel, the faint tremor still visible if you knew to look for it. But it no longer felt like a mark of failure, just a reminder that healing comes in many forms, and that sometimes the most important operations we perform have nothing to do with scalpels or surgical precision, but with the courage to speak truth when others have chosen silence. Some battles are won not with steady hands, but with an unwavering heart. If you saw someone vulnerable being silenced, would you find the courage to speak for them, even if it cost you everything you thought you had left to lose?